being the latest political figure to succumb to the virus this week in what seems like a class war. Now we've been able to get hold of the Kenya Union of Clinical Officers Chairman Peterson Wachira. Good evening again. Welcome back, Chairman. Just to start off from where we left, Kenya has lost nearly 2,000 people to the virus thus far, with the health ministry reporting about 28 deaths on Friday, the highest daily toll since the third wave of the virus. Now, there were signs of a pandemic fatigue just before the second wave. That can be a factor too in this third wave of the virus, don't you think?
Yeah, I do totally agree with you that if you look at our nature as Kenyans, we are very industrious people. But even so, we are also people who are very suspicious. And I think we have grown suspicious. The public has actually grown suspicious of anything that comes from the government of late for various reasons, and sometimes not very factual. So as I was saying, in the first wave, usually it will be a new disease. It will have a lot of panic. People are going to be very vigilant, and so they are going to follow each and every protocol that is given by the Ministry of Health and the government. And that is why in the first wave, only a few people will be infected. The deaths will be a bit lower, and the discipline will be there for the civic duties to ensure that people are adhering to protocols. Then after some time, they realize, so after using the protocols, they see as if because people are not dying, not so many are getting severe disease, they think probably that the outbreak they're dealing with is not as bad as they were told. And so they will start lowering their guard, and there'll be conversations like probably their government is going too far to do whatever it's trying to achieve. And I'm sure you heard that on the streets, that probably the government was going too far, a bit too far than they should. But they say that usually when you're dealing with the public, with an outbreak as the government is always accused of going too far. But when later you look at it from retrospect, then the government is actually accused of doing probably a lesser than expected job. So when it comes to now, the second you saw that there was a surge, and then people realized you mean this thing can actually kill. And people went back to being vigilant and following protocols. But the moment then that was mitigated, because of the time it takes, the toll it takes on the livelihoods of people, because of the socioeconomic dynamics of an outbreak, and people just want to go out there and work and be able to provide for their families, then it reaches a time when it goes down and people want to assume, they pray that now it's over and they can be able to continue as usual. And that is what has happened. I'm sure you have seen that Kenyans were actually not following any of the protocols, even in the matatus where they are complaining now that the government is discriminating. Most of them were carrying full capacity and even beyond capacity. You saw even our politicians and the top political leaders even holding meetings where people are not following these protocols, and they couldn't even castigate them. And that is one of the reasons as to why we are here. We open schools.
Chairman, allow me to cut you short there. It is ironic that the third wave of the coronavirus disease is concurrent with the vaccination exercise, but even healthcare workers are not convinced the vaccine is a solution. With you yourself being on record last week saying that you're a bit skeptical of the vaccine. What are your thoughts on that?
Thank you, and I think this is a very good discussion point. And I think what I said is that I took a wait-and-see approach, and right now I'm actually convinced that the vaccine is safe, and next week I'm actually going to take the vaccine. The problem that was there before is, this is a vaccine that has been authorized for emergency use. What that means is that it has not gone through the full trial to be able to be authorized for use, and it has not been followed over time. So nobody in the world knows about the long-term effects of the vaccine. But in the short term, it has satisfied all the requirements for safety, and therefore it can be deployed because of its effectiveness and because the benefits it gives outweighs the risks that it may present. So for now, I actually think that it is safe. Why the health workers were a bit skeptical is, number one, because we have never actually been involved. All the information that we are getting by our own. We have not been sensitized, we were not trained, because the expectation was that before even the vaccine lands in Kenya, there should have been sensitization, there should have been stakeholder engagement with the leadership of the healthcare workers, leaders, so that we can be able to see the best approach to be able to do this, and even to be able to try and project the fears and the concerns that might be there with the health workers and even the Kenyans, and see on the ways that we can be able to set up structures to ensure that these fears and concerns are addressed very fast and in a clear way.
All right, Chairman, I think time is not on our side. I'll have to let you go there, but many thanks for making time for us here on TV47, just to give us a sneak peek of what is expected in the third wave of the coronavirus disease. That was the Kenya Union of Clinical Officers Chairman Peterson